Good afternoon, good evening, good morning, wherever you may be. Little update on my progress health-wise. Getting much better, getting some more strength at the moment. Finding I can lift things that couldn't lift before, better coordinated. Definitely strength in the arms and the hands. Before, when I was at my worst, I couldn't even write my name. Now I can actually scribble notes to myself. I can operate a computer mouse okay and manipulate my way around a computer, so that's always good. Helps me with the other two channels that I've got, and that's the other thing, that I'm more motivated to actually do stuff, get out and about, work on my other YouTube channels, which are mentioned in my favourites down below somewhere. So onwards and upwards. One of the things that is still a persistent nagging doubt and irritant, I think is the right word rather than doubt, is the numbness in the hands and numbness in the feet and numbness in the elbows and the knees. And now I'm actually getting neuropathy, the kind of stuff that I hear that diabetics and others get, where it's actually painful to pick stuff up and it sort of hurts a little bit when I grip things. I consider that an improvement because at least I'm getting some sensation and strength back. So I guess that is improvement. So it's weird, but I guess it's good. But certainly coordination, balance, everything's better. I haven't bit the bullet and actually driven outside of the development I live in, but I'll happily drive a car or a golf cart round and the development, so that's an improvement. The other thing is I'm getting sorely irritated, literally and metaphorically, due to scalp problems. Got a yeast infection in my scalp, and also I've got toe fungus. Now I attribute that to when I was in hospital. I had steroids and all manner of cocktails of drugs, which I'm sure didn't help my constitution or my immune system. Up my sugar, which I believe sugar is like mold and yeast food. So also when I came out of hospital, it was very hard to wash my hair and keep myself clean generally. So I think that's when these little creatures actually took hold. So I'm battling microorganisms at both ends of my body and my scalp, and also on my toes. So it's a minor thing, but when you've got recovering from surgery, you don't really need that kind of shit, do you? So that's just a little more of an irritant, not that serious. In terms of general pain and discomfort, a little bit of ache on the neck, but nothing to write home about compared with some of the problems people have with spinal surgery. So I think my doctor, Dr. Wang, chief of neurosurgery at the University of Miami Hospital, God bless you, if there's a God, you did some fine work on me, and considering my nerves were squidged down to 2 mil, I'm mightily impressed. And also, as my nerves were that compressed, I think it's going to take a long while before I get normal sensation back, and I'm not even sure if it'll ever come back to what it was before. So, but I can't really complain because that guy, I would be in a wheelchair. One, if I'd have accepted my preliminary diagnosis of Parkinson's, and two, if I hadn't had the surgery. So I think I'm doing pretty well. I'm actually getting out and about. We've got a rental apartment down in Miami, and I went down there and did some cleaning and generally tidying up and manly stuff that men are supposed to do with screwdrivers and things. So I think that's definitely an improvement. I couldn't do that when we swapped out our last tenant. I had to basically stay home. So onwards and upwards, things are getting better. I think that's all for now. So thanks for watching if you're watching, and bye. Well, It will be bye-bye when I can actually turn the video off. So we'll try again, shall we?